We're going to go on and get started. So I want to let you know that this training is 100% supported by SAMHSA, the Substance Abuse and Mental Health Services Administration of the Department of Health and Human Services. I just wanted to make sure, are we recording currently? Okay, great. With this change, I can't see all the buttons that I need to see. So what you're going to hear today, the views and opinions, it doesn't necessarily represent the position of HHS, SAMHSA, or the U.S. government. So there you go. It is the views of the presenter. So the PTTC network welcomes and celebrates our diverse community of professionals. We really strive for inclusivity that respects the broad spectrum of identities and backgrounds and inclusive language. What is that? It's the recognition that words matter and that word choice can be used to include or exclude others. And using inclusive language communicates in a way that is respectful and brings everyone into the conversation. To that end, the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. So this is the PTTC network. There are 10 regional centers across the United States. We are in dark blue. We are housed at Wake Forest University School of Medicine in Winston-Salem, North Carolina. We serve 8 states in the region from Kentucky all the way down to Florida and over to Mississippi and Alabama. We're under the direction of Drs. Kimberly Wagner and Mark Wolfson. And the centers are really where your tax dollars at work. We are truly a free technical assistance and training center. We're all about building the capacity of the prevention workforce. So let me try and move this screen. Good. All right. So when the webinar ends today, or whenever you need to close out, you're probably going to see something pop up that says, warning, you're going to an external site. That's okay. Go to that external site because that is our evaluation of today. It's also known as the GPRA, the Governmental Performance Reporting Act or whatever, but it's the evaluation. So when you close out, whenever that is, you're probably going to automatically go to that. Let's hope it works. And complete the evaluation. Let us know what you think, because we do read through your comments and we share them with our presenters. And when you're done, when you finish, the certificate of attendance, which I know everybody's interested in, will automatically download for you, but you have to pause. I tend to rush through things too quickly, and when I finish an evaluation, I want to close it out. Just pause, take a breath, and the certificate downloads. If you have any problems with it, we're going to follow up with an email and make sure you guys have access to that certificate. Yes, this is being recorded. I'll get that question a lot today. We are recording the webinar. You'll be able to find today's webinar on our website where you went to register. You're also going to see session 1 recording. For those of you who weren't able to join us a week ago or 2 weeks ago, when Drew presented session 1, that is recorded and it is on our website. So make sure you check that out. Let's see, and we have a YouTube channel. You can go to YouTube and search Southeast PTTC, and all of our webinars are going to show up. So go through there, look at some topics. As I said, it's your tax dollars at work. These webinars are for you. So download them, share them with your coalition, share them with your coworkers. We're here for you. Let's see, at the bottom of our page, which is pttcnetwork.org/southeast, you'll find where you can sign up for our listserv. So if you're not on our listserv, make sure you sign up for it so you get all the information of upcoming webinars. And then there's another way there to get to our YouTube channel. So let's see what's coming up. Well, this is part 2. We have part 3 on June 10th. Again, it's at noon Eastern, 11 Central, 10 Mountain, 9 Pacific. So check out June 10th session. And then on July 11th, we're having an HIV A to Z 6-hour course. It's running from 9 a.m. Eastern, which is 8 a.m. Central, until 4 p.m. Eastern. So for some states, for those of you working towards certification, some states, like I know North Carolina and Mississippi, for prevention specialist certification requires a 6-hour HIV course. So here's a free offering of that 6-hour course. Sometimes those of you that are more mental health providers, you may be required to get those hours in. But even if you're not required to get those hours in, this webinar, which we've done a number of times, is amazing. We do it with Carolina's Care Partnership, and it talks a lot about the intersection. And it's an intersectional lens that they use talking about HIV with prevention and mental health and so many other factors. So I highly recommend it. You should check that out. All right, now we're going to move into today. So I want to introduce our speaker today, Drew Reynolds. If you weren't here last week, I'll let you know a little bit about him. He's the principal consultant at Common Good Data, where he provides data and program evaluation services to nonprofits and the public sector. In his consulting work, he advises organizations on how to use data-driven decision-making to design and evaluate effective programs, secure funding, and improve community well-being. While he serves organizations across many sectors, Drew, who is a social worker by training, has developed an expertise in providing data and program evaluation services for organizations in prevention, mental health, and human services and education. Drew also advises organizations on how to improve data and evaluation activities through a diversity, equity, and inclusion lens that attends to the culturally, linguistically, and racially diverse context in which many organizations serve. So with that, I'm going to stop my share, and Drew, I'll invite you to bring your slides up. And I want you to know that there is a chat feature down at the bottom of your screen. That's that little bubble. I think most of you have already found it. Do check the chat because we're going to put a link to the toolkit. Drew takes the time to create a toolkit for each of these sessions, which is quite amazing. So we're going to make sure that that link is put in the chat so you can download that toolkit, put any questions in the chat. And with that, Drew, I'm going to hand it over to you.
Awesome. Well, thank you so much, Kristen. Are you able to hear and see everything?
I am. Thank you.
Perfect. All right. Well, again, it's wonderful to see all of you, some of you for the second time, as we were joined 2 weeks ago to talk a little bit about preparing for grant writing. And today we're really going to focus on the actual proposal narrative, which is where all that writing goes in, so you can help strengthen your proposals for the next time you're writing a federal, state, or local grants. So if you can see here, you can download the toolkit at commongooddata.com/grant writing. You probably received an email with that link earlier. If you have not gotten it, I would just go ahead and kind of check that, back to that one more time. It will come to you, or check your email because it should be there in just a few minutes. Sometimes it takes 2 or 3 minutes to send through. Okay, so we'll go and dive right on in. One thing, just as an introduction that I'll mention too, is that I am a social worker and kind of come to this from a practitioner perspective, although most of my work is in data and evaluation now. And so I'll be drawing a little bit from that experience as I'm talking with you all. I also host a podcast called the Common Good Data Podcast, which I recommend checking out for those of you who do nonprofit and public sector work and are generally interested in seeing examples of other organizations like yours who are doing work in prevention, mental health, and other areas of human services with a bit of a data and evaluation lens to it. So check that out at commongooddata.com/podcast. Okay, so for today, this is the second of 3 workshops where we're focusing on writing that proposal narrative. I'll give a heads up that next week on June the 10th, we'll also be doing another workshop that uses the information from the first 2 to look at some real world examples. So you take an example of somebody who wrote something for a problem narrative, or writing some goals and objectives, or an evaluation section. And I'll provide some real feedback. And we'll also have a wonderful guest joining us, Carolyn Coleman, who's going to come on as well to serve as kind of a person who can provide some additional feedback in a different lens for you all. So we'll give you some information after this workshop if you're interested in participating in that. And also you can submit some of your own examples if you want to. Then we'll go ahead and provide feedback for those in real time. And I'll make sure to redact them as much as you want to if you don't want your organization or too much information about you shared in a setting like this one. So just as a heads up, we're going to have some real world examples to work through next week. All right, so for our agenda today, we're going to talk about problem statements, project descriptions with goals and objectives, putting together an evaluation plan, talking about staff and organizational experience, and I'll spend a little time on budgeting at the end. There's probably a whole workshop that could be dedicated to that, but I'll provide a brief overview at the end of a presentation for today. So I know many of you have been adding this in introduction, so it's been great to see folks from all over the country on this webinar, and especially those of you who are from Georgia and North Carolina, where I do most of my work. So it's great to see some folks and familiar names there too. I'll kick off this conversation by saying the first thing to do, and I say this every time I work with anyone, is to start by first reading the notice of funding announcement and then read it again and then read it again. Because they're dense documents and there's a lot of detail in them, and it's very easy to miss a very important detail for your grant before you get started. And I encourage you also, as you're thinking about, last week we talked about building a team when you're putting together a federal grant, have everybody on that team read it, because someone else is going to see something that you don't see. And getting that opportunity to have everybody engaging with that document in a very detailed and systematic way is going to help prepare you to write the best proposal and to avoid potential mistakes like leaving out key details that might keep you from receiving your award. So that's step number one. It says don't forget to read through that funding announcement. Here's an example of one for the Strategic Prevention Framework grant. We talked about different funding streams. This is a common one that folks apply for through SAMHSA. And I would recommend checking this one out. I'll obviously be following some of the examples from today are going to draw a little bit from this type of a grant opportunity. So this is an example. You go to SAMHSA's website, go through grants.org or their grants dashboard. Here you can access the notice of funding opportunity. And then you'll see often on these, there's a link to a PDF document. Make sure you're downloading those and reading all the way through those. Attend the pre-application webinars where they kind of explain a little bit about the funding announcement or opportunity in more detail. I really recommend checking those out, and all these sorts of resources. So I just wanted to give you guys a heads up about that prior to getting started here. Okay, so writing a compelling problem statement. And I'm actually going to focus a little bit more time on this section in particular because I really think a solid problem statement really sets up the rest of the grant. And I think I have some cool examples here that might be useful when you're trying to draft your own. So from last week's workshop, we talked a little bit about problems, thinking about how to assess a problem, thinking about what, how often, and where, and who, those questions that we can ask to provide additional detail and local conditions that give rise to substance use problems in the areas where we work. We also talked a little bit about how we prioritize problems, looking at the magnitude, how much it happens, how severe it is, whether that's trending up or down, and whether or not you think you as an organization have the capacity to make change on that particular challenge. You know, a good example of where that can be different is, you might say, we're really concerned about auto accidents involving alcohol. Those are very severe because the consequences for them are very severe for youth, right? However, the magnitude might not be that high because maybe you don't have that happening as often as, for example, youth showing up at school with vaping products. So what you're doing is kind of balancing how often the prevalence of something or magnitude of something versus how severe its consequences. And there's not really a perfect answer on how you weigh those balances. It's just something for you as an organization or coalition to be thinking about is where do you want to prioritize your energy, and thinking a little bit about magnitude, severity, trend, and changeability when you're making those prioritization decisions. And we also talked about risk and protective factor, and I got some examples down here. We spoke about that last week, but it's good to keep in mind as we're writing our problem statements. Okay, so the first thing you want to do is to think about what does a good outline of a problem statement look like. And for those of you who have the toolkit that have been downloaded, you'll see an outline that's very similar to this that you can use and kind of fill in as you go when you're putting together a problem statement. You'll begin typically with describing your population of focus. So what are the geographic bounds that are going to comprise the area where you're going to be working? And you can think about states if you're looking at a very big opportunity, or you might, in most cases, find a smaller geographic area like a county or a set of zip codes or census tracts to be able to define more clearly where you're going to be working. Some folks also often look at focusing on specific cultural groups, and there can be particular advantages to that, especially if your organization is well set up to do so. In the case of substance use prevention, it might be you work with Latino youth, or maybe you work with Native American tribes, for example, or LGBTQ youth, right? So sometimes you'll have those different groups that you can focus on, which you'd want to identify in that problem statement. And then some demographic details about that. And I'll give you some good details about how that population focus can come together. Once you set that up, we then kind of focus on your problem areas, right? So what substances are you particularly concerned about in your community? Things, I have the four here that are most commonly used: alcohol, tobacco, and vaping, I guess lumped together there, marijuana, and prescription drugs. And then describing that problem that goes beyond just, hey, here's a 30-day use indicator, that is able to really explain why that problem is a unique challenge to the community that you're serving, and how you are uniquely well equipped later in the grant to address that challenge or problem. I also recommend at the very end of a problem statement to have some kind of summary or thesis statement. And I actually will give you an example of how to do that with a bit of an outline too, so you can see how to put that together for yours. Because I think it does a good job of going from something really broad and general, like we serve this general broad problem in our area, to something very, very specific. Okay, let's talk a little bit about using some data. And what I wanted to do was to share an example for you all from where I live in DeKalb County, Georgia. Now, I actually don't do any substance use prevention work in DeKalb County specifically, but I wanted to share it because in part I thought it would be kind of cool to try an example that is unique to where I live, but also I think DeKalb County is a really good case example because it might be relevant to some of the areas where you work. Now, for those of you who are not from Georgia, DeKalb County is right outside, or I guess inside more or less too in some areas, the city of Atlanta. It's very populous. We have 750,000 residents as of 2022. And so when you're writing substance use prevention and you're working in DeKalb County, you can't really talk about the county as a whole when you're doing this because that's a huge group. So you want to sort of narrow and focus your work to be a little bit more specific. And you can do that by looking at some data to help for a reviewer who is not familiar with your county or not familiar with your state, help them to understand a little bit about where you fit within the broader prevention ecosystem inside your geographic area. So I'm going to give an example of what would it look like if you were to focus on serving Latino residents in DeKalb County and focusing on substance use prevention related topics, right? Inside DeKalb County, about 8.4% of county residents are Latino, representing roughly 63,000 people. So if you look at the county as a whole, that's kind of the broad numbers. But it's important to look not just at the county, but within the county. So most Latino residents, for example, in DeKalb County, live in the Buford Highway corridor. So you see this Highway 23 is Buford Highway, and that's where most Latino residents in the county tend to live. And so it can be helpful when you're identifying a problem statement to get more specific even than your county. So can you find census tracts? Can you find zip codes or other smaller municipal areas like a city, for example, within a county? Can be helpful to, again, narrow that focus so you can be more specific about where you are actually going to be doing your work. And so here's an example from DeKalb County. And if you look at just those census tracts, you can also then compare data from those census tracts to the county as a whole. And that can be helpful when you're trying to make a case for an area of disparity that you might be focusing on. And many of the SAMHSA CDC grants really are looking for proposals that are addressing health disparities in some very specific and clear way. So if you're trying to do that, and you know you're working with an area or a population that has great need, you want to specify that in your problem statement. So here, I was using a tool called the Social Explorer, but there's others you can use, or you can go straight to the US Census to gather some of these data, to look at the sum of data across all of these census tracts and compare those with the county as a whole. And you can see that you've got a difference in population, of course, ages 10 to 17, which would be the area you're focusing on. But you see that within this area, the number or the percentage of residents who are Latino is at 43% compared to 8.4 as a whole. So you're able to show that that's a real focus geographically in your proposal. You also see that there's some areas of disparity when it comes to things like the social determinants of health, for example. So we know that roughly a little more than a fifth of residents in this area do have less than a high school degree as far as their education is concerned. The median income is $5,000 less in this catchment area when compared to the whole county. The percentage of residents living below the poverty level is 5 points higher than the whole county. And the percentage of foreign born, over a third of residents in this area are foreign born. So again, when you're able to do a little bit more detailed analysis on your geographic area within something like a county or a state, you're able to give a little bit more information in detail, in context, that helps the reviewer understand what is unique about your problem, your challenge area, the area that you want to be focused on when you're writing this grant. So here again, just as a way of reiterating the point, you're able to also make the case that you're focusing on health disparities and showing that residents here are more likely to have less than a high school degree, more likely to be living or qualifying for living in the poverty level and having a lower median income when compared to other county residents, which then makes the case that using federal dollars to support a community, they should be directed here where the need is higher. So I know we've got, let's see here, we've got probably close to 200 folks or so on our presentation here for today. But I do want to make sure that we have some opportunities to engage and talk with one another. So I'm going to experiment with a question. And I'd love to turn it over to you all. I gave you an example of using some census data and some mapping to help share a little context about the work of one particular example project. But what are some other mapping techniques or census data that you have used in a proposal that you can share with others so that they can have some ideas? So go ahead and take some time to maybe add something to the chat if you have a good idea or something you've used mapping before to be able to talk a little bit about it. One example I'll give that I haven't shared here that I've seen some folks use is actually going onto Google Maps and actually having those like map dots indicating where there are tobacco sellers, what's the word I'm looking for? Sellers in a particular community, and showing the proximity of those vendors of alcohol and tobacco products to things like elementary or middle or high schools, right? So that's another example that you often see with mapping, to be able to look at how a geographic area might give rise to particular social determinants of health challenges and substance use challenges. So let's see what we got here coming in.
Steve has raised his hand. I don't know, maybe you might want to come off of mute and share.
Oh yeah, let's do. Can you do that for me, Kristen? I'm not sure.
Yeah, I think Steve, you can unmute yourself, I believe. Or if you can't, I'll unmute you.
Okay.
There you go.
Well, it's really along these lines, but to line up those attributes that are, such as demographics, to support that that we're being underserved. So not too innovative compared to some of these other answers, but I would just say line it up to the other aspects, which is the problem and what services are being underserved. Those demographics.
Wonderful, thank you, Steve. I appreciate that. And some good examples, to your point, Steve, also coming in on the chat. I see some example from Maricopa County of using a GIS program. Another one from Charlotte, using the Quality of Life Explorer. For those of you who work in it, I love the Quality of Life Explorer. It's a great tool in Charlotte. Those are good examples of local counties and municipalities who are using census data to do mapping and other types of tools in their communities to help often all kinds of decision-making, policy decision-making and others. And you may have access to that at a state or local level or within a particular city or municipality. And you'll know that, of course, better than I will, depending on where you live. But those are some of the best tools that you can really use to illustrate, some from a mapping perspective, some of those challenges. Connie mentioned school metrics. We're going to get to some of those later on. That's another great one. Looking at school zones and school metrics can be a great way to be able to do that. Overdose mapping will come up a lot because you'll see things like opioid dashboards and ER visits and things like that. A lot of public health counties, county public health departments will put together that information like that. And sometimes you'll get that from some larger health providers and things like that too. So some good examples. This is a really cool one too. Using the percentage of public health dollars available to underserved populations in Milwaukee County. What a neat example, right? Because you might make it even the case to say, hey, this area is also an area that is less likely to receive public funding. And if you can find that, that makes a really compelling case that someone like SAMHSA should be able to provide federal dollars to help make up the difference between one community that might be receiving a lot more public investment than another. Great examples all the way across here. So thank you all so much for sharing those in the chat. It just adds such a richness to the conversation. And I hope for those of you who've been following along, you've been able to give you some new ideas and ways to freshen up some of your proposals when you're thinking about writing problem statements. Now, after you've done some geographic work, usually using the census, using other information, using public data about your community to talk about your community and describe it, you then go in to talk about substance use data. And here I have 4 examples of what you can use, but also kind of highlighting the YRBS, which is one that I think everybody references at some point in this area of work, because it's really one of the best nationally representative sets of data that you can access that talk specifically about youth risk behaviors, including substance use. And in some cases with the YRBS, you'll actually see that they have local geographies. And in 2017, they had local geography for DeKalb County. So you could actually get county level, not just state level data from the YRBS. Now, that's not true for all municipalities, but it may be for yours. And it's worth looking into and referencing when you're making those applications. It's also important to take a look at the National Survey of Drug Use and Health. That can be very helpful. There's some state level reports there that can be useful. There's a couple other examples too, and we'll talk about these a little bit more. Our school climate and health surveys and county health departments. And in case of school surveys, a lot of times school districts, depending on state and federal law, may be required to publicly share data they collect about their students. And that can come from things like discipline data, but also school climate surveys that look at things like maybe bullying behaviors, or may even include some questions related to substance use. So those are great sources of data and information that you can use. And then of course, county health departments. Now, the one challenge with the YRBS is that the data, there's a lag. So right now, I think 2021 is the most recent data point that is up. So it's really great to use when you're writing your problem statements, but it's harder to use the YRBS when you're actually trying to track outcomes, because typically you won't have the data in time for when you need to report it. So I recommend using the YRBS for problem statements, but not so much for writing goals and outcomes and things like that. All right. The other thing I'll mention too, what are some other examples of data sources that you use from your own practice? And I promise I won't have you guys chatting all day long, but these two I think were great examples for us to kind of do a little bit of sharing as a group. So outside of the YRBS and some of the examples that I shared with you, what are some other ones up there that you've seen? Nina, great example there, talking about the SAVI database. You'll see a lot of times there are going to be local municipalities, just like with the mapping, will put together their own databases to kind of track these things on a local level, which can be so useful. Paul, great example there too, using the NCANDS. I'm not sure if that's how you're supposed to say it or not, but that's a database that looks at abuse and neglect. For those of you who in particular want to use an ACEs framework or a trauma and resilience framework, looking at data that focuses on abuse and neglect can be very helpful, or even looking at data from your Department of Social Services or the equivalent name of that in your state can be really, really helpful. Other great examples in here. Health assessments, excellent state level, Department of Mental Health will have some too, state level school districts, etc. These are great. Thank you all so much for sharing these. I know it's going to help others generate some ideas for themselves too. Amanda, I'm glad you mentioned focus groups, because I'm going to spend a little less time talking about qualitative data today, given the nature of the grant application, but there could be so much rich information that you can gather from focus groups. And I always recommend for groups to, even if they can't find any about in their local area, to conduct them themselves. Because when you're having direct conversations with youth and parents about substance use, it can be so revealing. And oftentimes speak to something that does not come through clearly when looking at larger data. Okay. Now, when we look at the YRBS, and I showed you back in 2017 that the YRBS did have was able to share information about DeKalb County specifically within Georgia, and not the state as a whole. And we're able to show that there is a little bit of disparity. When you compare Latino high school youth versus all high school youth, they were more likely to have their first drink before age 13. currently drink alcohol, be binge drinking, or obtaining alcohol by having someone give it to them. So Latino youth were at greater risk for alcohol use compared to the county as a whole in 2017. Now, I don't know if I necessarily recommend using data from 2017 when you're doing a grant application in 24 or 25, but I'm using it here just more to illustrate an example. Now, one thing I will mention here, and I wish I had, I'm realizing I should have had it probably written on the slide, is that I think that when we're writing about health disparities, it's important, given Kristen's point about inclusive language at the start of our presentation, to do so in a way that highlights a need without reinforcing stigma or without reinforcing existing differences and between cultural groups, particularly along lines of race, where I think we have to be careful about that. So I just wanted to kind of lift that up as we're thinking about talking about disparities. Because what I could also share here is that in DeKalb County in particular, the numbers for white youth is actually higher than Latino youth when you compare to all high school youth. And so if you're looking at disparities, sometimes you'll find that the information may counter some narratives we may have about who uses drugs and who does not. So I just want to keep that in mind as you're thinking about writing your problem statements. How do you identify areas of disparity and need without reinforcing existing social stereotypes and stigmas that may only further contribute to the problems we're all here to try to work on and address, right? Now, the other thing you can use for data is to look at discipline. And I actually have found using district data on discipline can be very helpful for substance use prevention organizations, in large part because school district data on discipline is, I believe, federally required. And so most states are going to have some way of sharing information about student discipline at a lot of times, not just at the state level, but also at the district, and in some cases, even the school level. So you can gather information. This is looking just at, they have these neat incident to action flow charts in Georgia that you can use to look at, okay, let's segment just those discipline incidents that were related to drugs and alcohol and look at how that breaks down by gender and by race ethnicity, and then also suspension type. How many led to out of school suspension versus alternative school and school suspension or other types of things, right? And so you can use these charts to show that Hispanic youth, 35% of drug and alcohol suspensions were for Latino students, despite the fact that Latino students only comprise about 20% of students across the district. And so you're able to show that students are having higher rates of disciplinary action taken against them relative to the population. Now, in this case, we don't have enough information to say why that may be happening, whether it's school district policies, whether it's particular schools that might be more, I'm not sure if the right word is aggressive, or just more willing to lead directly to suspension, or maybe have, there can be all kinds of local conditions that give rise to it. So we can't really say that much from these data, but what we can show is that there is that disparity. So again, when we're looking at trying to describe a problem in the community, we're able to look at these data to say, hey, there's something going on here that we need to explore further as a community. And how can we make sure that not only when we think of substance use prevention, not just as about preventing use, but also about preventing a whole broad array of challenges, thinking again from a social determinants of health perspective about the links between substance use and school attendance and discipline and child and family well-being as a broader piece, right? So so that's just another example of data that you can use. In the case of Georgia, they also have a health survey that's done across the state. And so you can look at school district data from the Georgia Student Health Survey, and they do ask a question on 30-day use. And so you can see here that they have the data across the whole state, reported using the days from 0, 1 to 5, up to 120 by grade level. And while in this case, I think it's really interesting data, the survey does not release substance use data on race ethnicity, so you can't really use it to specify specifically Latino youth, but it does release the data by school level. I didn't put that here because I'm not really interested in stigmatizing any particular school through this presentation. But as you're preparing your grant proposals, it might be useful to look at individual school level data or school district if you're working within a whole school district, to be able to, again, show those areas of difference or disparity when writing your problem statements. So here's the kind of a good example. Now, what I also think is interesting is that on the Georgia Health Survey, that, again, this is years later, so it could be that there was a drop since 2017, the YRBS data, but the data seem here to be closer to 7 to 12% as a whole versus what was probably closer, I think it was to 15 to 18% when we saw in the YRBS. And so you'll see that there's going to be different sources of data that are giving you different information, particularly when they're collected at different years. So it's always important to be looking at your source of data and how that information is being presented and where you might see differences there as well. Okay. But it's not enough to just say census data, 30-day use. What we want to do is then say, ask the questions, but why and why here? And those two questions, for those of you who've been in this field for a long time, I'm sure you've seen before when you look at things like developing logic models, right? So how do you get past 30-day use to talk about the local context and conditions that give rise to substance use challenges in your community? So I put here some examples. Not necessarily, this is not necessarily the case here in DeKalb, because again, I haven't done this project for real. But what are some possible reasons why Latino youth might be using alcohol at higher rates when compared to the county average? Well, we know that there's research that related to acculturation stress. So Latino families, a lot of times, particularly those who are more recent immigrants, are still engaging in a process of navigating two cultures. And when you're navigating two cultures, that can apply stress unique to that situation that those who do not have that experience would not otherwise have. So that could be one example. There could be some cultural factors or norms that are favorable to use. For example, certain gender norms, rites of passage. There was one group I've worked with that did some work around quinceañeras and how to have alcohol-free quinceañeras, for example. Or looking at cultural events and activities like sports games or soccer games. Sometimes there are unique cultural events, and this is not to say this is a unique to every culture has some type of rite of passage or cultural event, and some of them may include drugs and alcohol. And so sometimes it can be helpful to think a little bit about how those might contribute to access and use, right? We could think a little bit too about exposure to violence and trauma. Perhaps the group that you're working with, it has higher rates of exposure to violence or trauma than others. Or for example, you might look at, in this case, Latino serving retailers. So those organizations or retailers at a local level that might cater to a particular group, maybe they have higher rates of or lower rates of carding versus others. Again, I don't know if this is the case in DeKalb County or the case here, but I'm just giving you some ideas about how can you get past 30-day use. You as experts in your community are going to be able to answer some of these questions as to whether or not this may be true or not in your community. Kristen is adding in here too, things like store density, outdoor promotion, some great examples there too of things that you can think about to add context to the numbers. I think here is a great opportunity when you're writing your problem statements to cite research, right? Because there are people out there who have done research on each of these issues and can show, using empirical methods, some of those connections. So here's an example of an article that looks at pathways of acculturation stress to substance use among Latino adolescents that was published relatively recently that shows that connection. Now, when you're thinking about your group, there's probably some research out there that talks about some of these factors, these risk and protective factors that might give rise to use in your community. So I recommend once you've done your geography, once you've talked about substance use prevalence and 30-day use and things like that, to start going to research to say, what is it that's unique here? And what does the research tell us that could help inform the strategies that we're eventually going to take as a substance use provider or coalition to address substance use prevention in our community? A few other things to think about when it comes to data for risk and protective factors. For those of you who work with the DFC coalition, you'll be familiar with the 4 core measures, as Kadga calls them, right? Which will include 30-day use, but also peer disapproval of use. So how likely are youth to say that their peers would disapprove of them using a particular substance, their parents' disapproval of use, and in particular, I think perception of risk. It can be really, really interesting. And these data change quite a bit over time. And I know that, some of you who probably might find this to be the case in your community, but from the data that I've looked at, perception of risk, particularly around marijuana use, has changed dramatically in the past 10 years. And so paying attention, finding ways to look at these core measures, which kind of point to risk and protective factors that give rise to use, can be useful ways to talk a little bit about what makes your particular either your conditions locally or just that by substance, what makes it unique, right? Because youth will report that traditional cigarettes are very dangerous, but might not do so when it comes to talking about vaping products. Youth sometimes will talk about alcohol differently when it comes to parent and peer disapproval. And so you can see, versus other substances, so you can see some important differences here by substance that I think are worth illustrating in problem statements. So some other risk and protective factors to think about: school climate, neighborhood exposure to violence and trauma. Another good example of some public data you could use, you could look at crime and incident reports in a particular community, for example, to talk about exposure to trauma. You could look at data on parental monitoring or older adults. Sometimes it's harder to find that data, but if you have your school community does something like a pride survey or something that might ask a question like that, they might be able to help gather some information related to that topic. And then also things like access to youth programs and activities in faith community. So one example here that we could use in the case of DeKalb County, and again, I don't know if this is necessarily true in DeKalb County, but I'm just giving it as an example. Maybe Latino youth may not have access to resources in their schools and neighborhoods, including youth programs, which can contribute to health disparities. In that case, could be made that Latino youth and families would need access to culturally responsive programs. So programs that are offered, for example, in Spanish to their parents, or that are able to speak to the unique challenges that Latino youth may face, thinking again from a acculturation stress perspective. So those are some examples that you can kind of think about when you're trying to, again, add context and nuance to the problem statement. Kristen here also mentions social determinants of health for the community. So when you're looking at things like education, housing, economic factors, for example, all those things can contribute to some of the risk and protective factors that are in place in a community for youth. So some great examples there. All right. So I thought we'd turn back over to you all so that the group of many of us here today can share some ideas with others about the work that you're doing. What are some risk and protective factors that you have focused on in your grants and projects? So you can raise your hand or drop some into the chat. Just what are some things that you think are particularly interesting, or what have you found is really important for the community in which you work to be focusing on? And if you could drop some of those in there, that would be super helpful so that others can also gain some ideas and insights from the work that you're doing. One area that I've seen a lot of continued work in when it comes to risk and protection is looking at risk factors associated with trauma and resilience, which you mentioned slightly earlier in this presentation. So for example, looking at how there may be an organization who's done maybe even an ACEs survey or collected some data related to ACEs in your community that would look at things like child abuse and neglect, exposure to violence at home, family challenges or difficulties at home that could give rise to substance use challenges. And it may be that in one particular community, there's one of those that is more prevalent relative to others in another community. Let's see some others that we see here coming in the chat. Lisa mentions mental health symptoms. That's a great one. And you might actually see some local data from community health departments or others that will report on things like, for example, incidents of depressive symptoms that could be in a community as well. Kristen mentions rate of illegal sales to minors, which is a great example too, because if you have an organization like an Alcohol and Beverage Commission or some other state entity that might be tracking some of those, you can see where illegal sales to minors may be higher in one community than another. Looking at, for example, perceived risk, very good. Friend group usage, awesome. Norms favorable to drug use and parental attitudes, excellent. Ooh, a protective factor of school-based health clinics, very cool. These are some good examples. I love it. Yeah, accessibility in retail and social is really important. And again, I didn't share those examples here, but I think that can be one of a really great way to show data in a unique way. That goes, again, beyond those 30-day use indicators to give some context about why it might be unique in your community. Average age of DUIs in your community, interesting parent-child relationships, culture, and increasing community connectedness. Absolutely. I think there's some questions around community cohesion, which can be really interesting. How well do people know each other in your community? There's, in Georgia, there's a civic index, I believe. I can't remember the official name of it, but there's a statewide survey that looks at civic participation across the state. And you can look at things like propensity to vote, for example, or how well people might know others in their community, have friends in their community, things like that can be really helpful too. So some good examples. A few more in here: mental health needs, pregnancy, and drug use. Excellent. Thank you all so much for sharing. Okay, so now once we've done this description of the problems in the area, I want to share a little bit about how you can summarize the problem and go from the general to the specific to show you how it might come together. Starting first with population and geography. So here's an example. Latino residents in the Beaufort Highway corridor. Residents have lower education levels, higher poverty rate, and higher percent Fort Worth, right? Then you can go into substance use by saying Latino youth are using alcohol at higher rates than the county average, with some data to support that. That can then lead to certain consequences, like Latino youth are being suspended disproportionately higher rates at school due to alcohol possession. And the why here context that Latino youth may use more due to acculturation stress, unfavorable cultural norms, or unfavorable access. I should mention too here, there's probably a number of protective factors with cultural norms. We got to be careful too. And, I apologize for missing this as I was putting together the presentation, to look at some of the ways in which culture, like for example, connection, family cohesion, and others can be a protective factor in when it looks at substance use. And then 3, unfavorable access, right? So that's your why and why here context. And then lastly, you put all those together to make some type of case. You're setting yourself up for what you're going to do in your grant proposal. In this case, Latino youth may not have the same level of access to culturally and linguistically tailored youth and family prevention programs. And that might be contributing to all the problems above. And so we, as an organization, are writing a grant to provide more culturally and linguistically tailored youth and family prevention programs. Now, this need statement down here it needs to be like maybe a sentence or two in your problem statement. You can't say a problem statement, our youth lack access to the one program that we offer, and we're going to offer this program, right? That's not going to be sufficient to do a good problem statement. What you need in that problem statement is your first four areas here: population, geography, substance use, consequences, why here, and context. You're going to need those written out in more detail than the last one here. But I think it's important to have this last one stated because, again, it sets up your reader to understand where you're going. How you define the problem is going to, in turn, lead to how you define goals and objectives to address that challenge. And so what you'll notice here is that this one focused on alcohol, for example. It would make no sense for me to write a problem statement like this and then turn around to my goals section and talk about vaping because I haven't mentioned it, right? It would make no sense for me to talk about prescription drug use when this is what the problem was that I identified. So the key here is to make sure that you have really strong alignment. Once you have gone through this process of general to specific, that you have alignment from your problem statement directly into your goals and outcomes. Okay. So you can imagine a summary statement that looks something like this. In summary, Latino youth in DeKalb County are using alcohol at higher rates than their peers and are more likely to be suspended from school. A multitude of factors, including acculturation stress and exposure to trauma, make Latino youth uniquely susceptible to alcohol use at an early age with potentially lifelong consequences. And moreover, Latino youth lack access to culturally and linguistically tailored prevention programs to support them with these challenges. You have a version of this in your community that you could probably write. The key here is that having something at the end of that problem statement that summarizes all these things together, that takes all these different data points that might seem unrelated to someone who doesn't know your community, and to bring them together to make the case of why some funder should fund you instead of somebody else, why the problems and challenges in your community are so important and worthy of public interest and attention. Now you'll see here in the template that you got a chance to download here, some I like little charts and tech lists to kind of like remind me, or to take care of or to approach things in a different way, right? So I've got one page that looks at data sources, so you can check off which ones you might have access to in your community, what type of data they provide. You can add some lines here, so you can add others too that you might need in your community. Then here you've got a problem summary that has those 5 things that I spoke about here. You could write some examples in or jot some notes and then put it all together. So refer to the template when you're writing your grants. Okay, so that's the problem statement. Now it's time to move over to writing a strong project description. Okay, so writing goals. So this I actually took directly from the funding announcement for the PFS grant. Because again, as I shared before at the very beginning, reading it over again and again is so helpful, because those funding announcements have lots of information that can really help you write strong proposals. What I like here is that people talk about goals and objectives in a lot of different ways, depending on what your field is and who your funder is. And so it's good to understand, how does your funder define goals and how does your funder define objectives, right? We use the term SMART goals, but actually when it comes to SAMHSA, they really use the SMART framework, I'm skipping ahead here, for objectives, not for goals. So not that they shouldn't be, incorporate some of those characteristics, but that SMART, goals is really kind of a framework applied to objectives. SAMHSA defines goals more broadly, to say it like this broad statement about the long-term expectation of what should happen or what should change because of your program. So it serves as the foundation for developing your program objectives. The key here is that they should address outcomes, not the outcomes they should be achieved. So your goal shouldn't be, we're going to implement this program. That's not what you want for a goal. You want to be, we are going to change this particular condition in our community. So we're going to see a decrease in 30-day substance use. We're going to see an increase in public awareness about the risks of this particular substance, for example. Be specific about who will be affected by the project. Again, going back to your problem statement, who are you focusing on? And then leading to measurable results. So when writing goals, we have, these are some good examples too, again, straight from the funding announcement. You'll see the second one way too long, right? How can you make it more concise? And this one here, for the first one, increasing the substance use and HIV prevention capacity of a local school district. You want to be able to specify the program and effect in reducing the health problem. So you can see they give you examples of how you take an unclear goal and provide a more improved goal. And we're going to actually view some examples of this exact exercise in next week's presentation, where we take some written goals from you all. I'll provide some examples too, and how to make those better. So given our DeKalb County example, what are some examples that we could use to address the problem statement that I just shared with you all? Well, first here, I've got 2 goals. One of them might be to expand access to culturally and linguistically tailored prevention programs, because that was kind of in that need statement, for Latino youth across the county to reduce Latino youth alcohol use. Again, the focus here is we have to make sure that we include that last clause, reduce Latino youth alcohol use, because it wants to, sometimes my mouse clicks behind, to reduce youth alcohol use. So again, you're being specific here. It's something you can measure. Youth alcohol use is something we can measure. It's specific, it's concise, and it talks about what's going to change, right? In the second one here too, raising awareness about the risks and consequences of alcohol use at school as they relate to out-of-school suspensions. So down here we see, do goals address outcomes, describe the behavior and condition change, 3, describe who will be affected, and are they measurable and concise? These are 5 questions you want to ask yourself each time you're writing a goal. Do they do these 5 things? And if they do, they meet that criteria, maybe you ask one of your colleagues to help you find out and make sure that you're not missing something. Then you know you've got a really strong goal. Let's see here. There we go. So you'll see here, kind of as I just described for the first one, the goal addresses your outcome, substance use, describes the change, access to prevention programs, describes who benefits, Latino youth, and is concise and measurable. And the one down here addresses the outcome, suspension, describes the change, awareness of risks or consequences of alcohol at school, and describes who benefits, Latino youth, and is concise and measurable. So again, you can always ask yourself those questions to be able to take a look and see if your goals are meeting the criteria that are expected of you and the funding award. So coming back to SMART, S-M-A-R-T, for specific, measurable, achievable, realistic, and time-bound. And Darcy, I appreciate your example too in there by using SMARTY, which includes equity and inclusion as a part of writing objectives, which I think is a great way to extend the SMART goal metaphor that we often use to make sure that we're focusing on those important topics of equity and inclusion. Here you see these examples. Again, in the funding announcement, you're going to see that you've got how, what's non-SMART objectives and how can you make it a little bit better. And one of the things that I will mention in here is that you've got these objectives, and you see the parts in bold. We start to see things like dates. That's a really important one. By this date, end of year 1, September 30th of 2025, right? Or June 1st of 2022 is in this example. Being very specific about when you're going to accomplish a particular objective is so critical when you're writing them. In addition, having it measurable. So in this case, training 75% of health education teachers. So not just general teachers, we're going to talk about which teachers they are and how many of them are going to be trained by which date, in which district, right? So how can we take something that's general and make it more specific so that the reader understands that you know exactly how you're going to accomplish something? Because the challenge is when you write, when you see vague objectives, if you're a reader, you're probably like, this person, maybe they haven't talked to the school district yet. Is it going to be health education teachers, or is it going to be English teachers? Is it going to be elementary school teachers, like homeroom teachers, or is it going to be school counselors? If you haven't had the conversation with the school district yet and you don't know, it means that your project is probably less likely going to be successful, right? So the more specific you are, it can kind of communicate, hey, we know what we're doing. We've built these relationships. We've had these conversations with our partners. Again, that was a big emphasis in our last presentation about community partnerships. That's how you can really communicate to your readers that you know that you're going to be able to do something and have success with it. Okay. So then here's some examples about how some objectives that might fit these goals. So for example, for objective 1.1, reducing Latino high school alcohol 30-day use from 23% to 21% by September 30th, or enroll 40 youth and their parents in the evidence-based, culturally tailored Familias Preparando para la Nueva Generación, or Keeping It Real program by December 30th, 2025. So you see we have numbers around what's the expected change that we see. We say a specific number of people are going to be enrolled in this particular program by a specific time. Looking down, sorry, I'm getting ahead of myself here. In objectives 2.1 and 2.2, we're looking at reducing the number. Actually, 2.1 should be better. It should say how many suspensions, and I'm realizing I must have missed that as I was putting it together. You should say what your current baseline is for out-of-school suspensions and what your, desired reduction is. I thought I had 20% in here somewhere, but I think I must have missed that. In 2.2, if you want to host some town halls, how many? How many town halls do you want to host? How many people are you going to reach? Making sure that you have specific numbers in there. So it talks a little bit about the scope and scale of what you're trying to accomplish. Now you might be thinking to yourself, I don't know, what's a realistic number in change, in percent change in 30-day use, or in understanding, for example, perceptions of risk, or how many people do we think can come to certain events? And that's going to come with time and experience. So if you're new to prevention and you haven't written one of these before, talking to somebody in your organization who has had some experience about what you've been able to accomplish in the past can be helpful when you figure out, hey, is it realistic to think that we can get 60 people to come together for a town hall? Maybe it is. Maybe that number is really high. It might be really high in your community for your organization historically. I think as a rule of thumb, when you're trying to change something like some type of outcome indicator like suspensions or 30-day use, I think keeping it between 0 and 10% on an annual basis is really good at the most. You're not going to see a 30, 40, 50% change in a hard outcome like that over a short period of time, typically, even if you're doing the best work in the world. So try to, depending on the outcome, some it might only be 1 or 2% change that you're going to see. Others you might see up to a 10% change. So that can be a rule of thumb. I wouldn't say quote me on it for every case because there's probably some that could be higher or lower. But if you're not sure where to start, that might be a place to begin. Paul mentions a great one here. Including a due date is good for accountability, but sometimes results in over-promising. That is a good one. I'm so glad you mentioned that because sometimes we want to say we're going to change the world in these grant proposals, right? And what happens is we set ourselves up for something that we can't accomplish. And then for the next 5 years, we're like stressing every time you're submitting reports to SAMHSA or CDF, CDC, or whoever your funder is about meeting some of those big, outcome indicators. And I think, as you gain more and more experience with this project, in this field, setting realistic and achievable goals and objectives, I think is going to be more powerful than trying to have this big lofty goal that you're not going to be able to accomplish. Remember, your readers are reading hundreds of these, and they've seen projects that work and don't work, and they have a good sense of what's realistically achievable and what's not. So I think when you show good, like making real change, not saying no change at all, right? If you do that, what's the point of writing a grant, right? Good, solid, meaningful change, but also achievable. When you can get that sweet spot, I think it really communicates again to your reviewer that you have clearly got some experience on how this works and are likely to be able to accomplish the goals as they are written. Okay, once you've written your goals and objectives, you then have to describe your program and activity descriptions. There's a lot in here. So it's really, there's less sort of guidance on how to put them together. So I put together, I think, 5 questions that I ask myself when I'm trying to describe what we're going to do. So what is the activity in detail? Who will implement it? When will they do it? Where will they do it? And how will they do it? And I think for this, it's the who, when, where, and how that is so important. The folks who are reading are going to be familiar with prevention, and they're going to be familiar with your area of expertise. So you don't have to go into a whole lot of detail of like the unique curriculum of the particular evidence-based program that you're doing, or all of the different messages that are going to show up in the communications campaign that you're putting together. What they really want to know is, okay, of all the people we're funding, I see you've got 3 people, staff members funded on this grant. Who's doing what, right? This staff member's doing this, and this. Oh, you mentioned you've got 5 partners. Are the partners doing it, or are you doing it? How are you really engaging your partners? If you're relying on your partners to do it, did they understand that they're going to do it? Those are the questions that the reviewer is going to be asking. When is it going to happen? Thinking about timelines. Is it really realistic to think that you're going to launch an evidence-based program within the 3 months of receiving your grant award? No, because you're still hiring people probably, right? So those kind of like key implementation details, it's really more about the who, where, when, and where, and how. At least I think. I'm not a reviewer for SAMHSA, so I guess I should be careful about how much I'm thinking from that perspective or speaking for them. I don't want to do that. But these are the things that I think of, right? That I want to try to communicate to someone else is to say, hey, we've got this great evidence-based program, and we also know realistically how we're able to do that in our community. There's a good question here in the chat. What happens if we cannot fulfill the grant goals? Understanding that grant funding will stop, but are there any other consequences? Well, it depends. I think it's always good to be in conversation with your grantor. In not every case are they going to cut funding per se. It often depends on a nature of degree to the degree which that you're not accomplishing your goals or outcomes. I think if you're way off and you're not implementing things and things are kind of not working, yeah, you might run into some challenges with receiving future funding. But it may be that you said, hey, this was the outcome that we thought we were going to work on, but then we spoke and we had some town halls, we did another logic model assessment, and we had some more great focus groups with our youth, and they actually want us to focus on a totally different outcome. Depending on the funding mechanism, again, I can't really speak for all of them, you may be able to have conversations with your program officer where you say, well, hey, can we actually report data on this outcome instead of that one? That might actually work out depending on who your funder is. And so I think it's always good to be in conversation with your funder. Having more conversations with them, I think communicates to them that you're taking the grant reporting requirements very seriously and that you are a grantee who is willing to put in the work. So I think that those are some things to think about when you're kind of trying to figure that out. But it is a good point that you don't want to be putting yourself in a difficult position by overpromising. And I think that's a good principle to keep in mind. Okay, describing staff and organizational experience. Most of this, I think you're going to be pretty familiar with what to do. But what I encourage folks to recall, to think about, is to go beyond just academic degrees and professional titles when you're submitting resumes, bio sketches, and sharing your experience. For example, things you can include: experience working with or living with a population served by the grant. I can't emphasize this enough. This is, in fact, probably, in my opinion, one of the most important things you can include, but sometimes gets omitted. If you're working with Latino residents, mention that you speak Spanish if you do. That's an important thing. Language skills, cultural fluency. Including some achievements, some things that you've done before. Maybe you've managed a DFC grant or a PFS grant before, or some other federal grant mechanism. That can show that you're going to be familiar with requirements and likely to be successful if you were awarded another one. Thinking about publications or research reports. I think it's a great idea to publish reports from your organization regularly on your website. Even if they're not peer-reviewed research reports, you can say, hey, here's a report, our annual report on our outcomes for the last couple of years. We put that together every year. You can reference it right there. It shows that you're doing this great work of reporting and being transparent to your community. And then you can link that and say, hey, this is something I've done before. Years of experience, leadership experience, and history of collaboration and partnerships, all these things. And there's more stuff here. I know that you can, that you could include that might be relevant as well. Here's an example table of how you might put it together. One thing that I think is important to communicate is your FTE, right? So your full-time equivalent, which is to say how much of the person's salary and time is going to be dedicated to this project, and in turn, how much is going to be reflected in the budget. That's a key one here. You're only going to get 4 or 5 bullet points because, at least in the federal ones, because you just don't have enough space to include much more. So include the most important ones, right? Experience working with community, being bilingual, what your degrees are, years of experience, things like that. These can be examples that you can use. And I have this template this table is going to be reflected in that toolkit that I shared with you all. So you can refer to that as well when you're putting together your table for one of these federal grants. Over here on the left-hand side too, you see personnel name. You might actually include their actual name too if you want to when you're putting it together, but here I just have titles to include. Okay, I know we're okay on time here. So designing an evaluation plan. So you've put together your problem statement, you got some goals and objectives, you described the programs that you're going to be putting together. Now the question you have to ask yourself is, what are you measuring, right? And how are you going to be able to demonstrate that you've met those goals that you just described? Now, in your evaluation plan, the key thing is to add outcome measures to each of your objectives. Like having some kind of outcome measure for your objectives in a way that's being measured. So in the case that I shared with you all, you want to be showing that you can measure 30-day use in a school survey, for example, or the number of suspensions due to alcohol and drugs, or number of driving accidents. You want to have some of these core outcome measures and show exactly how you're going to measure them. What is the data source? Who's going to be in charge of collecting it? How are you going to report on it on a regular basis? And if you can, sometimes there's not enough space in these grant applications. Again, you only have 10 pages for the federal ones. Also include how you're going to measure and track your outputs. Now, if it's a big grant, you might have dozens of outputs. So you might not be able to include them all, but include the most important ones, the ones that are going to clearly show when you go out and talk to someone and say, hey, we were successful, these are the 5 things that I want to talk about. So, for example, how are you going to count how many people attended a town hall or how many people you reached in a communications campaign? And in some of these federal grants, they're going to have very specific details about how they want you to measure these and what counts and what doesn't. So you want to be familiar with those, and they may be available in the funding announcements. So how will you measure it? When I used to give presentations like this, I used to go straight into collecting data, straight into talking about surveys and how you can do that quantitatively, or even looking at interviews and focus groups. But I've learned to shift in my practice to invite people to focus on secondary data. And what that means is data that other people are collecting. And the reason for that is because data collection is so hard. And if you take a lot of time developing surveys, implementing surveys, and then you get frustrated because there's not a big response rate or it didn't work out the way you wanted it to, and you put all this time into data, it's taken away from all the programs that you could be offering when you could have just gone to the school district's website and looked at suspension data, or just gone to their school district website and looked at a school climate survey or the YRBS or something else, right? The more that you can use data that's already out there, especially data that's required federally to be reported and it's going to show up consistently on an annual basis, the better off you'll be. Now, you're not going to be able to get everything because there's a lot of times your community won't have local data on 30-day use or on peer perceptions or parent perceptions of use. And so you may have to do a survey. And when you do that, know that it's going to take a lot of work, put the right energy into it. If you need to bring in some expertise to do so, you can do that. But begin with secondary data first. Then focus groups, key informant interviews. So here, again, and this was mentioned before, and we don't have time to talk about it as much today because we're focusing on grant writing, but on an evaluation seminar you might be, or workshop, you might be able to get more detail on this. Focus groups and interviews are so important. Hearing the voice directly from the youth and parents that you serve is one of the best ways to understand what's really happening on the ground. And it's going to provide you all kinds of context and information that a data point just simply won't. And so I really encourage you to think about incorporating some form of qualitative feedback in every single grant proposal that you put together in some way. Here's an example too of a chart that you can use to kind of track all of this. So you'll see here, using the examples that we had, I've got my objectives lined up 1.1, 1.2, 1. These are examples from the goals and objectives section that we already put together. Again, showing that alignment across sections and saying, hey, this is how we're going to collect it. And I gave you here, the first example in 1.1 is using a health survey. Second one is, okay, we're going to do a pre and post survey of our own program. Okay, so we're doing a little data collection. And then 2.2 here, we're looking at out of school suspensions, again, collected by somebody else. And you can see here when we look at frequency and responsible staff and how you're going to track it, it gives a little bit of information about to the reviewer. Does this person understand when the data are collected? Do they have somebody who is capable of going out and extracting that data and reporting it correctly? Again, it's not easy. Not everybody will want to do this. So you can find out the right person on your team to take it on. And then looking at what is the analysis going to look like? What are you actually looking for? So in this one, for example, for the Georgia Health Survey, we're looking at a change in percent over time. In a pre and post test, here we have something called a t-test, which is a statistical test you can use to see if there is a statistically significant difference in a particular outcome at pre and post. So sometimes you might be able to share a little bit about the type of analysis that you're going to do in advance, which again communicates to your reviewers that you really know what you're doing in evaluation. And I think, in my opinion, I think evaluation is one of those areas where you can really excel and kind of have your application maybe stand out among others. So I do recommend spending some good time with it and bringing in expertise if you need to accomplish that section. Okay, a couple other things to think about when it comes to data security and management. A lot of times, actually, especially with federal proposals, there's increasing attention being paid to the importance of you making sure that you're keeping people's information secure, especially when we're talking about sensitive topics like trauma and resilience related data or substance use related data. It's really important that you keep that secure and confidential. A couple of things that you can mention, thinking like saving on a password or protected or encrypted drive, limiting access to users and specifying in your grant application who's going to have access and who won't. Talking a little bit about how data might be shared or transferred or not shared and transferred. One thing I like to do in proposals too is be specific about how data will be shared in the aggregate. And where it says there is set a rule for less than N for sharing, that is to say, I try to share or encourage the folks that I work with to not share data on individuals, even though it may come off as aggregate. A good example is this and say, hey, here's the rate of substance use in our community for maybe a subgroup that's really small. Maybe it's LGBTQ youth or transgender youth or Native American youth, right? And maybe there's only 2 or 3 in 5th grade or 7th grade or 10th grade, and you report that number. Well, it's going to be pretty revealing about who that's reflective of. People are going to know who that person is. So I try to say, never report data on a group smaller than 10 people, because that way you can prevent a situation where someone might inadvertently be identified because of the different ways that you're segmenting your data. So you can include things like that to help keep information secure, right? I also mentioned data security agreements here. If you have a relationship, for example, with a school district or a public health department or some other institution that is allowing you to have access to data that includes maybe personally identifiable information or things like that, or otherwise secure data, it's important to talk about data security agreements, what's in them, and that you might be interested in having one with a provider to ensure that those data are kept secure. So that might be a good thing to consider. When you're actually protecting participants, from a research ethics perspective, I really like looking at the Belmont report and the 3 principles of the Belmont report. This is a bit researchy, But if you looked at three key things always to be thinking about. Number one, informed consent. So how are you going to make sure that youth and parents know what you're doing if they're participating in a program or taking a survey, and understand the potential risks and benefits of taking a survey or participating in an evidence-based program, and then making sure that that's communicated to them before that they consent. And then also talking a little bit about the selection of participants and ensuring that the risks and benefits are equally shared. Right? We wouldn't want one group of people to have all the risks and then another group of people to have all the benefits of whatever it is that you're offering. So those are some three things to just keep in mind when you're putting together your proposals. Next here, I'll mention also around dashboarding. It's important to talk a little bit about how are you going to report data, and not just say, hey, we will report data, but giving a little bit more detail about it. Who's going to do it? How often are you going to create dashboards? What will they show? What information will be updated and when? How will it be shared with the community? And most importantly, I think, is how will that information or data actually drive decision making? So will you be looking at data on a monthly or quarterly basis to recognize, hey, we might need to course correct? You know, if these are 5-year grants and you start something and then all of a sudden a pandemic happens, you might have to change a little bit about what you're doing, and how that information or data comes to you and how you use that data is going to be really important to make sure that you're using data when you're informing that decision making. So talking a little bit about what that process is like can be real important in evaluation sections as well. Again, recognizing that you are reporting to your funders, and evaluation, we always think of that as a thing that happens at the end. But can you do it and integrate it into your day-to-day so that the data that you're receiving on whether it's a quarterly or annual basis is being used to help inform your work? Again, I have some examples and tables here that you can use inside the template to kind of just jot some ideas. The template can be something you can use maybe as almost like a planning sheet or an outline when you're tackling your next federal grant. So you'll see examples of how to look at evaluation plans and questions to consider in the template there too. All right, last thing, about 5 minutes, we'll do the budget and then we'll wrap up for questions. So for budgets, the first thing is federal grants are always going to have a template, and use it. Just 100% use it. I know it says strongly encouraged, just use it because it's going to help calculate everything for you and present everything and all the information you need in the way that the funder wants. I used to have a teacher who used the phrase "don't annoy the bear" when he was talking about himself and reading like our papers that we submitted or whatever. And I think it's a good principle in life, is think about it from the perspective of the reviewer. How can you make it easier for the reviewer to understand what you're doing and to be successful in that way, right? Also, I think it's very important to include someone who's got some strong financial background when doing a template. Someone who's like a CFO or an ED or whoever it is that your organization, whatever their title is, who's in charge of budget, they should be looking at this document and be really well informed about how it works, and also informed on your programs to make sure that the programs are adequately represented in the budget. A couple things, funding areas. There's some things that you can fund, right? Staff, program materials, construction, indirect costs, all those things. Two things I'll mention on this slide is, first, don't be afraid to fund your staff. Sometimes people are afraid to do that. Like, do it. Ask for staff funding and fund the people that you need to make sure that the program is going to work. Don't be afraid to ask for indirect costs, because your organization is going to need it. And sometimes you're not going to get indirect costs from other sources of funding. Federal funds are sometimes the best places to get access to those types of funds to sustain your organization beyond just having people, right? How are you going to be able to fund all the other stuff that you need? That's what indirect costs are for. So always ask for those, and then build in, after you've got those line items filled out, then go back and say, all right, how much money do we have to be able to implement this program for travel, equipment, supplies, or contracts, or other things. So start with staff and indirect, then work your way backwards to the others. Construction is in there, I know, but I think most of them probably don't in substance use prevention supply information for construction, but you may have a grant that allows for that. So that's something to keep in mind as well. Then lastly, actually, Kristen mentioned a good one too around funds. Looking at stipends for community residents, you can use stipends for so many things. Like if you're going to have community residents who are going to engage in work on behalf of your organization but aren't really staff members, having some type of incentive, maybe somebody's facilitating a small group with youth on a regular basis, give them a stipend, pay them for the work. If you can even use incentives for your surveys and things like that too. In some cases, there's restrictions on some of them. But you can build in some of those incentives to pay people to take your surveys. Having funds that come from these grants go directly into the community is such an important thing to be thinking about. So make sure that you include some of those in there. I highly, highly, highly recommend it to include some of those. So thank you, Kristen, for mentioning those as well. There's a question too about where we can get access to the budget template. Usually you'll see that right alongside the funding announcement. So in the funding announcement, I took an example there from the PFS grant, but you'll see it in the funding announcement. It'll say, here's the budget template, click the link, and you'll be able to access it there. Okay, so budget narratives. After you've done your budget and you've filled out all the numbers and everything that goes where, you need some type of narrative that's going to explain to your reviewer how the budget reflects what you talked about in your project narrative. And again, it's one of those things where they're going to say, hey, you're funding staff for this, but that staff member is never mentioned in your activities. Why? You don't want that to happen, right? You want to make sure that every staff member that's mentioned in your project narrative is also reflected in the budget somewhere. You talk about incentives over here. Make sure that you've actually budgeted for incentives and not left it out on accident like I did for this presentation, right? So make sure that there's that alignment between your narrative and what you're actually going to do. That's the most important thing. And where you run into, or when people run into trouble, is when their CFO is told to do the budget, but the CFO or the ED or whoever's in charge of the budget doesn't come to any of the meetings about the grant. Well, if they don't know what's going on, they're not going to write a budget that's going to be reflective of what you talked about. So it's important to have whoever's doing your budget included in some capacity in your planning project for the grant, or else you're going to run into some alignment challenges and difficulties. All right. Okay, I know I was probably talking a little bit quickly there. That kind of wraps us up for today. So project, you're putting together a project, your proposal narrative, finishing up with the budget. I will pause at this point and take questions. You can hop off or raise your hand or drop it into the chat. Would love to take questions.